key markers to longevity is keeping your glucose and insulin low. Oxidative stress will accelerate aging. It will increase inflammation. It will make you more vulnerable to the virus.
In today's fast-paced world, we are constantly bombarded with information on what foods are best for our health. But what if I told you that some of the healthy foods you're consuming every day could be silently harming your body, accelerating aging, and even feeding cancer cells? It's time to look deeper into the science of food and understand how what we eat can affect our long-term health. In this video, we will discuss 4 commonly consumed vegetables that might not be as healthy as you think. You might be surprised at what you discover, especially considering how many of us believe these foods are essential for our well-being. But there's a twist. By the end of this video, you'll not only understand why these vegetables could be doing more harm than good, but you'll also learn how to make better choices that support your health, longevity, and vitality. So, if you're ready to change the way you think about food and take control of your health, keep watching until the very end. This could change everything for you. 1. The science behind longevity and metabolic health. One of the fundamental principles of aging gracefully and avoiding chronic diseases is keeping your glucose and insulin levels low. According to Dr. Mindy Pelz, a fasting expert and nutritionist, the key to living a long, healthy life lies in managing these markers. When we spike our glucose with sugary foods or refined carbs, we create oxidative stress in our body. This accelerates aging, causes inflammation, and makes us more vulnerable to disease. Oxidative stress occurs when there are more free radicals in the body than antioxidants, and it wreaks havoc on our cells, aging them prematurely. By focusing on foods that stabilize blood sugar, we can reverse this damage and maintain youthful energy. Dr. Pelz emphasizes avoiding foods like refined sugars and carbs, especially those made from highly processed ingredients. But here's the catch. Many vegetables, when consumed in large quantities or prepared in the wrong way, could trigger the same harmful effects. Let's look at 4 specific vegetables that might be doing more harm than you think. 2. Potatoes, the starch bomb. Potatoes, whether white or sweet, are staples in many diets around the world. However, according to Dr. Pelz, conventional potatoes, especially those from non-regenerative farms, can be problematic. These potatoes are high in starch, which when consumed rapidly spikes blood sugar levels. A spike in blood sugar can lead to a series of metabolic issues, including insulin resistance, which is a precursor to type 2 diabetes. It's the same effect you get from drinking a glass of sugary orange juice. You feel the sugar rush, but a few hours later you're on a metabolic roller coaster. For individuals looking to lose weight or improve their metabolic health, eating conventional potatoes could exacerbate problems instead of helping. Dr. Pelz suggests opting for sweet potatoes from regenerative farms instead. These types of potatoes are rich in resistant starch, which feeds beneficial gut bacteria and helps maintain healthy blood sugar levels. Story example. I remember a patient who came in for a consultation about his diet. He was eating baked potatoes every evening, thinking it was a healthy choice. Over time, he gained weight, felt sluggish, and struggled with sugar cravings. After switching to sweet potatoes and incorporating more vegetables, his energy levels skyrocketed, and he lost weight effortlessly. The key change was understanding the impact of conventional potatoes on his blood sugar. 3. Iceberg lettuce, the nutrient-empty green. Iceberg lettuce is a common feature in salads and is often marketed as a healthy choice. However, when we dive into the nutritional profile of iceberg lettuce, we find that it's essentially a food that provides little to no real nutrition. Dr. Pelz warns against including iceberg lettuce in your diet, especially if it's sourced from conventional farms. Unlike more nutrient-dense leafy greens like spinach or kale, iceberg lettuce is mostly water and provides very few vitamins and minerals. In fact, it can actually deplete your body's stores of essential nutrients by being difficult to digest and metabolize. Story example. A friend of mine, an avid salad eater, switched from iceberg lettuce to mixed greens and kale in her diet after realizing the lack of nutritional value iceberg lettuce offered. In just a few weeks, she reported feeling more energized, had better digestion, and noticed a clearer complexion. The change was simple but impactful. Lesson learned: not all greens are created equal. If you want to maximize your vegetable intake, choose darker, more nutrient-dense leafy greens that offer a wider range of health benefits. 4. Carrots and celery, the monoculture trap. Carrots and celery are two of the most common vegetables people reach for when trying to eat healthier. They're low in calories, high in fiber, and often seen as an ideal snack. However, Dr. Pelz points out that consuming the same vegetables day after day can create a monoculture effect in your gut. By eating the same vegetables repeatedly, you're limiting the diversity of beneficial bacteria in your microbiome, which is crucial for overall health. The key to a healthy gut microbiome is diversity. Just like in nature, where different plants support different species. When we feed our gut with a narrow selection of foods, we risk undermining our microbiome's ability to function optimally. This can result in digestive issues, weakened immunity, and even poor mental health. Story example. I had a patient who was eating carrot sticks and celery every day as part of her attempt to eat clean. Over time, she developed bloating and digestive discomfort. When we revamped her diet to include a variety of colorful vegetables, peppers, cucumbers, radishes, and spinach, her gut health improved dramatically, and the bloating disappeared. Lesson learned: variety is key when it comes to vegetables. By mixing things up, you ensure that your gut flora remain diverse and healthy, which is essential for your overall well-being. 5. The dangers of refined oils in vegetables. Many of us are conscious about the oils we use in cooking, but it's easy to overlook the types of oils used in processed vegetables and prepared dishes. Dr. Pelz warns against vegetable oils such as canola oil, sunflower oil, and soybean oil, as they are high in inflammatory omega-6 fatty acids. These oils can lead to cellular inflammation and contribute to insulin resistance, both of which are major factors in the development of chronic diseases, including cancer. Story example. A patient I worked with had been using canola oil for years, believing it was a healthier choice than butter or lard. After switching to healthier oils like olive oil and avocado oil, she noticed a reduction in joint pain and inflammation and even lost weight. Lesson learned. When it comes to oils, always opt for unrefined, cold-pressed options. Healthy fats like olive oil and avocado oil support cellular health and reduce inflammation, while processed oils can have the opposite effect. The role of intermittent fasting and diet in cancer prevention. In recent years, intermittent fasting, IF, has gained significant attention as a powerful tool for health optimization, particularly in cancer prevention and overall longevity. This dietary approach involves cycles of fasting and eating, typically restricting the eating window to a specific period of the day, e.g., 8 hours of eating followed by 16 hours of fasting. While intermittent fasting has been shown to have numerous health benefits, its role in cancer prevention is particularly noteworthy. But how exactly does fasting help fight cancer? And why is diet equally important in this context? Let's explore the science behind how intermittent fasting works and how specific dietary choices can enhance the body's natural ability to fight cancer. 1. Intermittent fasting and autophagy, the body's cellular cleanup process. One of the most significant ways that intermittent fasting contributes to cancer prevention is by promoting a process known as autophagy. Autophagy is the body's way of clearing out damaged or dysfunctional cells, including potentially cancerous cells, and recycling them for energy. This natural cellular cleanup mechanism plays a crucial role in maintaining healthy tissue and preventing the accumulation of damaged or mutated cells that could potentially lead to cancer. During periods of fasting, the body experiences a decrease in insulin levels and an increase in glucagon, a hormone that promotes fat breakdown for energy. When insulin is low, the body is able to enter a state where autophagy is activated. As the body breaks down old cells, it removes dysfunctional components, including misfolded proteins and damaged mitochondria, that may contribute to the development of cancer. Research shows that prolonged fasting cycles can stimulate the production of stem cells, which contribute to tissue repair and regeneration. These new, healthy cells replace old, damaged ones that may harbor mutations linked to cancer. In essence, intermittent fasting gives the body an opportunity to reset itself by eliminating potentially harmful cells. Example: studies involving animal models have shown that intermittent fasting not only reduces the growth of tumors, but also enhances the effectiveness of chemotherapy. This could suggest that fasting enhances the body's ability to fight cancer naturally, while also making cancer cells more vulnerable to treatment. 2. Insulin sensitivity, reducing cancer cell growth. Cancer cells thrive on glucose. As discussed earlier, cancer cells exhibit the Warburg effect. where they rely on glucose, sugar, as their primary fuel source even in the presence of oxygen. This means that the more glucose available in the bloodstream, the more fuel is provided to the cancer cells, promoting their growth and spread. One of the key benefits of intermittent fasting is its ability to improve insulin sensitivity. Insulin is a hormone that helps regulate blood sugar levels, and when the body becomes insulin resistant, it leads to higher blood sugar levels. This creates an environment conducive to cancer cell growth. By fasting, you give your body a break from constant insulin release, reducing blood sugar levels and, in turn, decreasing the supply of glucose available for cancer cells. Through regular fasting, insulin sensitivity improves, meaning the body can process glucose more efficiently. The result is a more stable blood sugar level, which makes it harder for cancer cells to thrive. Additionally, fasting has been shown to lower insulin levels overall, further reducing the chances of feeding cancer cells. Example: a study conducted on patients with insulin resistance, a common condition in those at risk for cancer, showed that intermittent fasting helped lower insulin levels and improved glucose metabolism. This not only reduced cancer risk, but also helped manage metabolic conditions that can lead to cancer. 3. Fasting enhances the immune system's ability to combat cancer. Intermittent fasting doesn't just clean up cells and regulate insulin. It also supports the immune system in fighting cancer. Fasting can promote the regeneration of immune cells, particularly T cells, which play a critical role in identifying and destroying cancerous cells. In fact, one study found that fasting for 72 hours could enhance the immune system by promoting the production of new white blood cells, which are vital in detecting and eliminating cancer cells. Furthermore, fasting has been shown to reduce inflammation, a condition that is known to contribute to cancer development. Chronic inflammation can damage healthy tissues and create an environment where cancer cells can grow uncontrollably. Fasting helps to lower inflammatory markers such as C-reactive protein, CRP, helping to prevent the inflammatory processes that may promote cancer development. Example: one clinical trial found that cancer patients who underwent a fasting regimen before and after chemotherapy experienced fewer side effects and better immune function. The fasting period helped their immune systems recover faster, allowing them to better fight off the cancer cells while supporting overall health during chemotherapy treatments. 4. Dietary choices that support intermittent fasting in cancer prevention. While intermittent fasting is powerful on its own, it can be even more effective when combined with a cancer-fighting diet. What you eat during your eating window is just as important as when you eat. By choosing foods that are rich in antioxidants, anti-inflammatory compounds, and essential nutrients, you can enhance the benefits of fasting and further reduce your cancer risk. Foods to focus on during your eating window. 1. Cruciferous vegetables: broccoli, cauliflower, kale. These vegetables contain compounds like sulforaphane, which have been shown to help detoxify carcinogens and reduce the growth of cancer cells. 1. Cruciferous vegetables also provide fiber, which is essential for gut health and overall detoxification. 2. Berries: blueberries, strawberries, raspberries. Packed with antioxidants, berries help neutralize free radicals in the body, reducing oxidative stress that contributes to DNA damage and cancer cell formation. 3. Healthy fats: avocados, olive oil, nuts. Healthy fats, especially those rich in omega-3 fatty acids, help reduce inflammation in the body, which can suppress the development of cancer. 3. Omega-3s also have been shown to inhibit the growth of cancer cells in some studies. 4. Green tea: rich in epigallocatechin gallate, EGCG, a potent antioxidant. Green tea has shown promise in preventing cancer cell growth and inducing apoptosis, cell death, in cancer cells. 5. Turmeric, curcumin. Curcumin, the active compound in turmeric, has powerful anti-inflammatory and antioxidant properties. 5. Studies suggest it may help prevent cancer by targeting specific pathways involved in tumor growth. Foods to avoid. 1. Refined sugars and carbs. As discussed earlier, sugar feeds cancer cells and contributes to insulin resistance. 1. Minimize the intake of refined sugars, processed foods, and white carbs like bread, pasta, and pastries. 2. Processed meats and high-sodium foods. These foods have been linked to an increased risk of colorectal and other cancers. 2. Processed meats in particular contain carcinogenic preservatives like nitrates and nitrites, which can increase the risk of cancer. 3. Alcohol. Excessive alcohol consumption is a known carcinogen and can contribute to the development of liver, breast, and colorectal cancers. 3. Limiting or eliminating alcohol can significantly reduce cancer risk. 5. Combining intermittent fasting with exercise is another cornerstone of cancer prevention. When combined with intermittent fasting, regular physical activity can further enhance the body's natural ability to fight cancer. Exercise not only helps to lower inflammation, but also increases blood flow, improving nutrient delivery to tissues and the removal of waste products. Moreover, physical activity has been shown to support immune function, which plays a crucial role in recognizing and destroying cancerous cells. Example: a study found that individuals who combined intermittent fasting with regular exercise, such as high-intensity interval training or strength training, had improved cellular repair mechanisms and increased autophagy. This combination was particularly effective at reducing the risk of cancer and supporting overall health. Conclusion: intermittent fasting, when paired with a healthy anti-cancer diet, is a powerful tool in cancer prevention. By promoting autophagy, enhancing insulin sensitivity, boosting immune function, and reducing inflammation, fasting creates an environment in the body that is less favorable for cancer cell growth. Combined with a diet rich in whole, nutrient-dense foods, intermittent fasting can significantly lower the risk of cancer while supporting overall well-being. As we continue to learn more about the intersection between fasting and cancer, it's clear that this lifestyle change, along with conscious dietary choices, offers a proactive way to fight cancer before it even starts. By incorporating these practices into your daily life, you can empower your body to stay resilient, healthy, and strong in the face of potential threats like cancer. By adopting these changes, you can begin to feel better, age more gracefully, and reduce your risk of disease. Let me know in the comments what changes you plan to make in your diet, and don't forget to subscribe for more health tips.